Hey there VCE HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at environmental factors and health conditions in Unit 3 VCE HHD. Before we dive into this video, just a reminder there's a range of different ways you can engage with the Health Resources Hub. We've got our YouTube channel where there's over 100 content videos, SAC and exam tips, and there's new videos going to be coming out each week during the school term this year. If you're on YouTube, you can subscribe with the button in the bottom corner of the video there, or you can just search YouTube for Health Resources Hub. If you subscribe, you'll get alerts to all of those new videos that are coming out each week. Also, you can head to our website, hrh.net.au, where there's opportunities for teachers and students. And if you're Unit 3 and 4 student, you can scroll to the bottom of the page and register for our free student newsletter. Will be coming out twice a term this year. You'll have SAC and exam tips and also free resources, so please subscribe to that. You can also see you've got our social media links there if you'd like to follow us and get alerts to our new videos and other opportunities, and also our email if you'd like to get in touch. So we have done two previous videos on socio-cultural factors and biological factors. And so this one's obviously focusing on environmental factors and how you can make links to health conditions in Unit 3 VCE HHD. So as I've mentioned previously, this is particularly relevant when looking at population groups in Unit 3. So that might be, say, males versus females or low SES versus high SES, because often what you're asked to do is give an example of, say, an environmental factor and outline how that might contribute to a difference in health status between these population groups. So when we're talking about environmental factors, we're talking about the physical surroundings in which people live, work and play. And you can see there's a list of environmental factors there. So it might be geographic location, the quality of the air and water in which you live, your workplace, your housing environment. And so there's quite a range there of examples that you can choose from. And so here you can see is a snippet of a table that I have put together and I use with my students, and I'll also be sending out in my free student newsletter. So if you haven't signed up to that and you'd like a copy of the more extensive version of this, make sure you head to our website and sign up. But what you might be asked to do is give an example of an environmental factor and link it to a health condition. And so this table here gives you an opportunity to practice making that link. So for example, for housing there, you can see that poor quality housing might lead to exposed timber and wiring, and that could contribute to injuries. And so it doesn't have to be a super detailed and complicated link, but you have to show how that particular example of an environmental factor might contribute to a health condition. So for work environment, you might talk about a work environment might expose an individual to heavy machinery, and that could increase their risk of injury as well. And then finally, for geographical access to healthcare. So people that live a long way away from healthcare services might find it more difficult to access regular health checkups to help diagnose conditions such as high blood pressure. And if that goes undiagnosed, it might contribute to a condition such as cardiovascular disease. So being able to show how those environmental factors are linked to health conditions is important. And so I've got a more extensive copy of this table here of about 10 or 15 examples. And so if you'd like to get a copy of that and look at some of those different ways in which you can link these different factors to health conditions, please head to the HRH website and sign up, because that version will be coming out in just a few days. Okay, thank you so much.